Hi, good morning, good afternoon, wherever you are in the world.
Good evening.
That too.
Globally.
And it can be the UK. So as far as I know, I have friends over there. So hi guys, hi ladies, hi everyone. My name is Zulma Verdejo, and I'm the owner of Serene Fusion, and I'm the admin of the Facebook group, Resilient and Apologetic. And today with me, I have.
Hola, everyone. Buenos días, buen día, buenas tardes, buenas noches. Yo me llamo Flora Luyando, Doctora Flora Luyando. Hello, good evening, good afternoon, good morning. My name is Dr. Flora Luyando.
And I'm so happy that you're here again with us. It's just a joy and a blessing to have you, to have to chat with you. I love you, and it's like, oh gosh, we are friends and we haven't even met face to face, but we talk so much that
we are friends. And that's the beauty of this technology that has allowed us to get closer when we allow ourselves to be a little bit more open. And we have a lot in common.
Exactly. And you know what? We have been talking about cancer here, cancer there. And today we said, let's chat about thyroid cancer. And Flora, I know that cancer, you have a story for us, it has touched you as well. Tell us.
Yeah. Different forms of cancer has touched me, but this particular cancer that we're going to be discussing today is thyroid cancer. Mi abuelita, my grandmother, the lady that I was named after, the one that helped raise me, beautiful and so graceful, Flora. She passed away with thyroid cancer, a particular one that is not as common, but lymphoma. That affected her thyroid and lymph nodes in that area. And she's still dear to me. And, I actually call my business Flora Healing, not because of me. Many people don't really know that, but I am willing to share that today, that it is named after her, to continue the wonderful work that she's always done. She's helped people. She was an herbalist naturally. She was a definitely healer naturally. I come from both sides of my family in the health field, in the healing world, in doctors, whether Western or Eastern, and coming from the roots of Puerto Rico. And I'm so glad that I am able to discuss this with you because you're from the Isla de Puerto Rico as well.
Me too. Yes, I was born and raised there. Beautiful island. I miss her so much. Thank you for that. And I'm so sorry about your grandma. And as you're talking, I'm thinking, how common is thyroid cancer?
Well, actually, it's not as common as I shouldn't say number one, the number two things that we're in for the February month is breast cancer. That is the number two killing cancer of the United States. But thyroid cancer is rare, but it's needed to be talked about because many people even realize that 25% of people that have thyroid cancer years later, maybe months later, have breast cancer. So it's correlated somehow. It's unknown, but it's important to discuss. And some of the symptoms that are seen in the beginning of thyroid cancer that people do not tolerate is coughing, not associated with a cold, but most people think, hey, let me associate with a coughing cold. No, it's a continuous cough that you don't have a cold. That's number one. Number two is your voice starts becoming very hoarse, very, very hoarse. Voice, throat pain, nodules on your side that may now extend to your jawline, to your ear. Very painful. And there are about four to five specific ones. The number one that is very common that most people get affected by with thyroid cancer is called papillary cancer, which affects the hormones. That is more common and is usually related to stress levels, imbalanced chemicals of hormone imbalances. That is very, very common. But when caught in time, they remove the thyroid and And if when I say caught in time, it hasn't spread to your other organs, and it has been removed before then, you have a higher chance to survive. But if they catch it and it has spread to your other organs, there's a lesser chance of surviving it. But that is why I am here today to discuss symptoms that most people do not correlate that it can be thyroid cancer. Because of those signs. If people may say, oh, because I have a sore throat, or because I sing a lot and I'm just raspy, or because I do have a cold, or I may just because, I just have jaw problems because I grind, don't, if these are consistent, please check it out. If you have history in your family of cancer of any sort, please check it out. And always get a second opinion. When you see your general doctor, actually go check out a specific doctor that relates to cancer, because they have more technology now. So those are the things that I think is very important.
Yes, you know what, as you're talking, I remember right now a friend of mine that she had thyroid cancer. They removed her thyroid and I lost contact with her. And I just found out, maybe I would say last year, that she had breast cancer. I thought that 25%, you said, of people that have thyroid cancer can get breast cancer. Now,
correct.
As we're talking, and we were to be talking, for a while before this conversation, I'm thinking, we don't want people to be scared.
No.
These calls are not about people to be scared and say, oh my God, oh my God, oh my God. It's about being
awareness.
Being aware.
Right. Being realistic. I think that I'm here and I'm so thankful to be a part of your platform here as well. Because, we have to allow people to understand that it's not about being fearful, because you're actually being more of the problem if you are fearful. Yes, I understand that you can be a little nervous. That's fine, right?
Exactly.
A little emotional. But if you avoid it, I call that avoidance. When fear becomes now avoidance, then that's something that will affect your health. Fear to avoidance avoids so many different things. And by the time you are in such a major pain and can't cope with it, or you have a big lump, you can't do anything else. It's now metastasized, that has spread to everywhere else. And then you no longer may be here for your child, for your own self, for your family. So at times, let that little fear be that prevention and that awareness to just check it out, because thyroid cancer can be stopped when you get it sooner, when you look at the symptoms sooner and you go to the doctor sooner.
And one of the things I'm getting for what you're saying is that I'm very aware of my body. I said, okay, this, that there's a knee problem. Okay, I have like kind of knee pain. Okay, I have inflammation. I can take this herb, that herb to reduce inflammation. I can call I have holistic physicians that work with me here in my area. I have you in New York, and I don't let it go. If I have, I know the symptoms of inflammation. So if I have a lump, I'm going to say, okay, 1 day, 2 days, 3 days, my body's telling me today. So what we do, I see many people doing, they're on the go. Oh, I have a little bit, I'm going. And they are ignoring. They don't taking the time to sit down and say, wait a second, when did this start? It's been 1 week, 2 weeks? No, it's been a month. I have to check this.
Right, because when you catch it in time, when it comes to specifically to thyroid, because again, there are different variations of different forms of thyroid. It can, as specifically the hormone thyroid cancer, papillary thyroid cancer, is due to hormones. So you can find women, which again, it is found in men too, but it is highly seen in women as well. It's highly seen in women, but from the ages, sometimes 20, 30, that's how young it has become. So it's important that if you feel that and you understand this now, you can actually stop it and they can remove your thyroid before it spreads to your other organs. And it's a higher result of living as healthy as possible before it spreads to your organs.
We have been talking about cancer and the signs and this, and I'm thinking, okay, I'm here right now. What can I do? Okay, so besides paying attention to the signs, you mentioned one time about the gut, good bacteria, about type of food to eat. And I know that this is, we will not have time to go deep into that, but what about, what do you think about what I said?
Well, I mean, let me begin by, there's different formulations, right? I really believe that Eastern and Western works well together. But if people choose not to, fine. But in the method of combining both, I've seen greater results. Please keep that in mind. With an acupuncturist, with traditional Chinese medicine, with Ayurveda, with massage therapy, with naturopathic doctors, along with the Western doctors. I've seen wonders because we're here to assist. We help with the pain. We help with chemotherapy, and going with your Western doctors with major technologies that's happening now, it's amazing. So try to keep an open mind of combining both. If not, just remember these things, that also when it affects the hormone levels in traditional Chinese medicine, when we specifically speak on papillary thyroid cancer, it's stress. You know, how we look at in traditional Chinese medicine, it may be that you never had a voice. Maybe you were little and they always told you very forcefully, shut up. That could be one. Number two, it can be you have so much stress that you're overusing your voice, and now you're so angry and you're always screaming. So you overused it, causing the imbalance of your cells. And now the cells are running rampantly that it can't be controlled, because that's what really cancer cells are. They're running rampantly now. Keeping it like that in traditional Chinese medicine. Another thing is during times of changes in the lives of women, it already chemically is imbalanced. So when now you have these other factors on top of that, workload, stress, it's now going to increase a thyroid dysfunction. And so we have to keep that in mind. So how you manage your stress, the way we look at it in traditional Chinese medicine, what you eat, food is medicine. So more green leafy vegetables, for example, kale, very good. Spinach, very good. These dark green leaf vegetables, also what's good for the blood, because there is another thyroid that is not very common, thyroid cancer, that affects, it's called medullary thyroid cancer, that affects the blood, which is one of the least common ones of thyroid cancer, but it does exist, right? So making sure that you eat enough vegetables that can build your blood, enough folic acid that can release gases. We also have another thyroid cancer that is called follicular cancer, and there's two types. You'll find that more in the older elderly generation, which are 60 and older, and which increases, which is called it forms quicker, and so you'll find it in 65 and plus older. It's not as common, but it is common in that age group because it affects the other part of the cells of thyroid. And the least common one, which unfortunately my grandmother passed away from, was lymphoma, lymph cancer. So it's different variations, and I know we don't have that much time, but I wanted to break it down just a little bit and keep it as simple. But remember your stress level. Remember how to go to the doctor and be more aware when you're starting feeling like, okay, this cough has
Don't wait,
because it may not be a cough. You can actually prevent it from spreading to your organs if you catch it quick and make time for yourself. Don't wait. Like Zulma says, take more action from your body. Be more proactive with your body.
Thank you. Thank you so much. Yes, I'm thinking about being aware, pay attention. and seek help.
Exactly. Proactive.
Yeah. Okay.
Action. Right? It's kind of like when we're in a fire, right?
Exactly.
Drop, roll, look,
And one of the
and go, right? So go to the hospital, go to the doctor.
and make yourself important. Make yourself, what you say it, because you know one of the things that I come to mind is like we have many women in the group, resilient and unapologetic, that are 40 plus, 50 plus, and right now in this day and age, we are taking care of our parents, our elderly parents, and sometimes even the grandchildren, because of COVID, they are being homeschooled. They have in the class, they're home at home in the how and I can't even speak. And what happens is I'm taking care of everybody, but ourselves. So as I listen to you, so be proactive, take make time for yourself comes to mind as well.
Absolutely.
You
And
know,
I
if you
say
can,
this to other people, and I believe because it's so common in women, and we are in February, and it's about breast cancer awareness, and because 25% of people that have thyroid cancer in a few years may get breast cancer. I want you all to look into my eyes and understand this. It's very important to be proactive. It affects more women. And I believe it's because women are so, I got this. I can do this. I can take care of my mother. I can take care of my father. I can take care of my children. And I can take care of my husband. That sometimes can be a child. No pun intended. But come on, we try to do it all. But we have to understand that we have to take care of ourselves. You can't keep running with your engine because your car is going to give out. So take time for you. And that's why we are here to discuss this today, Zulma.
yeah. And if you don't take care of yourself, if you're not good and healthy, you can't take care of anybody else. So that's one of the things that I had to learn with my kids that were physically handicapped and conditions. So we are going to let you go, doctor. Thank you for your time.
Thank you.
Yeah, you're welcome. Thyroid cancer is a topic of the day. And if you want to, we want to ask you questions, a consultation. You do it virtually?
Yes, I also do it virtually. I am in person, but I also am globally as well. And you can reach me at florahealing.com, florahealing.com.
Yep. And then you, if you don't find her or you forget about it, you can find me at serinfusion.com or at serinfusion@gmail.com for emails or in the chat.
Yes, you can find me as well. You can even find me on Instagram at Flora Healing. There's so many ways to find me. And I thank you as well. You do a lot of virtual healing as well. And I commend you as well. You do massage therapy, you do energy work, you do it.
I used to. I don't do much.
No? So what? Wait. So what do you do virtually? I mean,
okay, virtually, I do energy work virtually. I was doing it on site, but then I decided not to do massage therapies. I doing herbs, or herbal too, and holistic. But thank you. We had to chat about that later.
Yes, we have to share each other's work. That's a community space, baby. Puerto Rico and all over the world. We have to take care of womanhood, sisterhood, imanas.
Yeah. So see you. Thank you, guys. Thank you, ladies. Thank you, everybody. It was a pleasure being here with you. Thank you, Flora, for everything.
Muchas gracias. Stay well, guys. And stay
De nada. Be a blessed day.
Yes, you too.